housing, it might be park improvements, it could be after-school programs for youth or senior activity programs. A very wide variety of activities that we can fund with CDBG. It's our largest funding source. The second is the Home Investment Partnerships Act, HOME, and as its name implies, it is specifically intended to increase the availability of affordable housing. So for rent housing as well as home ownership housing in our community to improve the quality of housing that exists and improve affordability. Emergency Solutions Grant is specifically targeted toward homeless and to those at risk of homelessness. And Housing Opportunities for Persons with AIDS, or HOPWA, is specifically targeted to individuals and their families who have HIV or AIDS and who are at risk or are homeless. So how have we spent these dollars in the past? So primarily our categories fall into 4 main areas: affordable housing, community services, homelessness, public facilities, and public improvement. Annually, we receive anywhere from $9 to $11 million in our programming. It really depends on the program year and whether or not we have carryover dollars from prior years and prior projects. But primarily, our new funding is about $9 million a year, and then we have funds locally that we bring and add to the pot. A little less than half we spend on affordable housing programs. And again, these range from building new rental housing, rehabilitating housing for rent that's affordable, rehabilitating homeowners' homes, assisting nonprofits like Habitat for Humanity and self-help enterprises to construct new housing. We also provide about 1/3 of our dollars to public facilities and public improvements. And like I said before, those are things like park improvements, road improvements, sidewalks where there aren't sidewalks in neighborhoods. These are intended not to fix problems that needs to improve or enhance a facility or to build a new one where things don't exist. So building a new sidewalk, reconstructing a street, replacing a play structure in a park. About 11% goes to homeless programs. These include emergency grants to nonprofits who support homeless individuals through wraparound services, getting them to into permanent shelter, which is the primary focus of our programs. And then community services, another 11% is spent on activities like after-school programs for youth, senior enrichment programs, programs for domestic violence victims, those kinds of things. So we're going to talk a little bit more about each one. So like I said, affordable housing can have a wide range of activities. These are paid for out of multiple grants, and so these are not just in the home program that I talked about before, but these are also in our community development block grant program. So affordable housing development, building new, tenant-based rental assistance, assisting low-income individuals with rent to ensure that their is stable. Housing rehabilitation, which generally involves bringing a property entirely up to a minor repair grant program. So if you have a problem, your roof is leaking or you need a water heater, we do have programs that are minor repair programs that can help with small individual projects. Senior paint program. This involves more than just senior paint. There are many activities that we do under this, including building of ramps for accessibility to individuals, ensuring that seniors have the ability to get in and out of their homes, improving the livability of the house. And then programmatic compliance, which is in all of our programs, probably one of our key functions is ensuring that we spend those dollars accurately. Community services, in addition to after-school programs and senior enrichment programs, we also fund fair housing, education, job skills training, and again, programmatic compliance. One of our really key accomplishments last year was a program in job skills. We partnered, two agencies actually partnered together and trained individuals to learn how to install solar panels, and then went to another agency and actually installed the solar panels on the roof of that agency. So we used two different grants to actually do the job skills training, plus then a public facility improvement. Homelessness is a high priority. We have specific funds that are allocated to those currently. We have the programs I talked about before in terms of housing persons and their families who are living with HIV/AIDS, rapid rehousing, getting individuals off of the streets and into permanent housing. Emergency shelter, we have limited dollars are available for emergency shelter. Homeless prevention and outreach, so reaching out to individuals on the streets to find out what their situation is and finding out how we can get them into housing and preventing individuals from becoming homeless. And we also have a program where we share data and information among the agencies in Fresno. And lastly, again, about a third of our dollars are spent on public facilities and improvements. We have completed roadway and pavement construction. We have designed, built, and improved parks, and we're working on a community center design right now for in East Fresno. New recommendations to nonprofit facilities. So last year we had a number of agencies that applied to the city to improve their facilities. These included the Marjorie Mason Center, which is a domestic violence center. We had homeless shelters that needed improvement, new roofs, new HVAC, and those were public facility improvements as well. So these are the kinds of programs that we fund, and these are areas that are our priority areas right now in our current consolidated plan. In June, we'll finish our 5-year cycle of our consolidated plan, and we'll be starting a new 5-year cycle, and that's why we're here today. So we have been working over the past 4 months to gather community input. And so just a little bit of background, there were community meetings held at the very beginning of November to gather input from the community regarding types of eligible activities that most needed funding in our community. And after that, we took all of that information and we went back out to the community and we identified 12 needs that were particular priority in the November meetings. And we said, are these the things that you as a community were talking about? Do these resonate with you? Do you feel that these are the priorities that exist in our community, are the most needed? And we asked the individuals who participated in that round of meetings, which was the second week in December, to rank 3 from each of from that 12. And so today, what we're going to be presenting to you is the summary of not just those meetings, but kind of the culmination of what we heard from the community. The 13 community workshops, 500 surveys, 25 focus groups where we interviewed stakeholders and nonprofits in our community, said what are these priorities and how should we spend our dollars over the next 5 years. So when we presented this data to the community, when we presented all of the needs, this is what came out of those. These are the top 5 needs that were identified by the community. Number 1 was homelessness. It ranked as high need by almost 70% of individuals who came to all of our meetings. So that was our number one priority, and it's significantly higher than our other priorities. Public services. These are community services like after-school programs, like wraparound services for the homeless, like senior enrichment programs. A little over half of the individuals who participated said that those were a high need. About the amount said affordable housing. So a little over half of our participants, again, said affordable housing is a high need in our community. And then right at 50% of individuals ranked infrastructure and public facilities. And again, park improvements, street improvements, sidewalk improvements, lighting in neighborhoods were ranked about half of the individuals as a high need. And then lastly, about 40% of the individuals said that economic development in our community was a high need. So we've taken all of this input and we have written 6 priority needs statements based on the input that we have received to date. And I'm going to turn over the next section of this workshop to Edward Chenevere, who is going to lead us in a prioritization exercise at tables. And we're going to group into 2 tables. We're going to do a Spanish table and we're going to do an English table. And we're going to sit and prioritize these and talk about these priorities. So with that, Edward, I'm going to turn it over to you.
Okay, so for the exercise, once we get organized, oh, looks like we've got some more people joining us. Excellent, welcome. So on this slide, you'll see the 6 priority needs statements, which I'm sure many of you have already seen both in the handouts as well as on the boards here. So what we're going to do once we break up into our groups is take a minute to introduce yourselves. So just take about a minute each and tell us what brought you here today, your name, what you do in the community, or what you're really passionate about. And then in 20 minutes, we're going to go through the priorities that we discussed, that we've displayed. And for each one of those, just discuss, do you agree with the priority? Why or why not? Your facilitator is going to be taking detailed notes as we go through those. And then, would you word them differently? So if you see something that's missing, maybe there's a theme or an idea that doesn't seem to be present, or maybe something is in one of the priorities that you want to change, certainly take a moment to make that recommendation for how you would change that priority statement. And then next, we're going to break up from that and move on to how you would actually like to spend the money in each category. So if you were us, how would you divvy up those funds to address affordable housing needs, homeless needs, etc.? If you have specific organizations in mind, we would love to hear those. Or even if it's just a general idea of, I would like to see X activity without a specific organization. Lastly, we're going to report to group to actually report to the room about what you've learned in terms of, do you agree with the priorities? Is there anything in particular that you would have changed in the priorities? And maybe 1 or 2 of the items that your group decided So with that, any questions on the slides? And we will have facilitators table as well. Great. To groups. So if there's anyone who would prefer a Spanish-speaking table, join this table here.
gonna.
Have anybody else to join in English? Join us.
Oh, thank you very much. I appreciate it. No problem. We got so many hands to spare.
Speak English?
Absolutely.
Just check it out.
My name is Karen Jenks. I work with the City of Fresno in our Housing and Community Development Division, and I'll help facilitate tonight. I'll walk through each of our need statements. I think we'll just go first. Would you like to start?
Sure. My name is Gracia. But now I work for Council for Justice.
Davis, I'm born and raised here in Fresno. I work with a nonprofit called Daddy Up. And the importance of fatherhood. So.
Grade 18. We both work for Daddy Up and a nonprofit. Doing all this stuff.
Retired from the city of Fresno. I lived here for 49.
I'm Kim. I'm a kindergarten teacher. I live in the area.
Get my sticker off. I work for the county of Fresno, Department of Social Services, just a resident, longtime resident there.
Nickolas Wildstar. I'm running for Mayor of Fresno. I'm also the chair of the Libertarian Party of Fresno.
Well, welcome everybody. So if we'd like to get started looking at our need one, we'll be able to get some feedback if you would change some of the wording, or if you feel like something is missing from it, or if you feel like these need statements really do cover all the issues, because that's pretty hard, but if you do. So if we want to start with the first one, provide assistance for the homeless and those at risk of becoming homeless through low barrier shelter options and housing first collaboration.
So I want. And we can switch gears if this doesn't work as well. But maybe a show of hands if you address with this.
Those at risk of becoming homeless. What do they determine that?
This HUD determine.
Well, there's a definition. Sort of is just the way it sounds. So there's maybe a would pay the month with them in event. Maybe there was a unforeseen medical need, or perhaps some other event, and they realize we're looking at their money, that they're not going to be able to pay their rent. So how you can respond to that programmatically is through a technique or a program called Word. And you can, assuming it's marketed and people know about it, you can shop with some help from someone. You'll call them a case manager, if you will. And they may direct you to a program, or perhaps the program isn't needed. You just need more time. And it could be something as simple as the case manager reaching out in that instance to a landlord and saying, particularly if in the area of good rental history, they have a history of paying their rent, things like that. Can you need more time? And then that's emergency assistance type of program. That can be as simple as a hotel motel voucher, assuming the landlord isn't going to do work with it at all. And the Poverello House, for example, has a voucher system. So those are types of stuff. But your question, that would be an example.
Yeah, I'm just curious to see, if somebody's unemployed for a long time, and you have, you're on the verge of almost being homeless, So, do they get the help? Or you just gotta go through it?
So I'm curious to know what you think. What would you like us to try to trust, especially maybe at the margin?
I think it's important. Don't let them get homeless.
Yeah.
When the question was asked, or whoever you guys took the survey with, how was the question asked, and then what kind of was the reasoning behind why the people were saying they thought this was one of the top priorities? Why is it because there's some on the street, or is it because they know that there's a huge issue as far as people, on the verge, they've looked at the PG&E, the assistance program that they have, or so many people are using that program. How did they figure out that or how did they determine that that's the highest priority?
Yeah, so I can tell you there's two main ways. One was quantitative, right through the survey. We asked questions. The questions were worded in such a way that it was, identify for this need, homelessness or those at risk of becoming homeless. I can't remember exactly what the needs were, but all of those questions that landed in that homelessness category were the highest rated in that high needs category, the most likely to be represented with that. But then, on the other hand, at the community meeting we went to, we heard from folks over and over again who were concerned with that issue, and in particular, we had folks that were actually had experienced homelessness who came and told us about what services and facilities would have been beneficial to help prevent them from landing in that situation or to get out of that situation. So it's both. We heard from people, and then we also had quantitative data that showed. Yeah.
My own family, when I'm with friends or even me and my wife, we see the homelessness all around, and that's just by visual, seeing people just out, and now it's everywhere, River Park, it's, over here, it's everywhere. So I just want to know, is it something that's only based off of visual, or like you said, you have actual testimonials from people saying, I've been in this situation. Me and my own family, we've been in places where we've had, almost been there too, as far as like PG&E being shut off, stuff like that. So I understand that there is a need in that sense, but I just want to know, how did people come up to it? This is the highest priority. That's all I'm asking.
Then I guess the challenge is and the at-risk levels there out there now. There's a lot of different things. Some homeless just don't want to have homes. Address this now. Just kind of coming up with another conceptual program that's just really going to so that you can send them to the same place that everybody else sending them, or you're going to develop something really than just send them to the PG&E, to Poverello, to these places like that, and that's really not really addressing the homeless problem that we have right now. It's really an epidemic almost thing now. I mean, I've never seen so much homeless in the city. So now how are we going to direct funds and resources to something like this that's going to really have something more impactful in really helping get people off and getting them really ready for homeless. So and that takes money. lot of people, they don't prioritize the money and they find themselves in this situation. So come up with something a little more substantial than the run-of-the-mill things. So
That's great feedback.
And it sounds like there's consensus, or nobody has said that it's not a high priority. We can focus on with this one, and we could come back for the second round is what exact activities we want to fund under that priority.
Well, that's what I was thinking. I'm sorry to mean to interrupt you,
No, go
but
right ahead.
I see that term low barrier thrown around, and to be honest with you, I'm not really sure what you guys are describing.
Right.
How would you define it?
Well, low barrier through my employment is West Care, it's Marjorie Mason. It's facilities where I don't see any restraint. I see them taking folks in without not a lot of check and balance on who's going into the facility.
So, West Care applies what they call
thrown around, and I seen it was something that the folks got behind, but I'm not really clear that it was really defined in any of the past information.
So high barrier would be clean, to gain admission, you would need to be clean and sober.
Well, I worked in a facility that worked with the homeless, and it would be when I take what I used to do and I see what folks are suggesting, I already have an opinion formed. I don't like to share that stuff because I work, but it's right along the lines of what this gentleman was saying. So I have a lot of concern when I see the term low barrier tossed about. And I know that you guys aren't tossing about it. That was just the way that it was written in the report.
And that concern is driven, sounds like it's driven from your experience, that there, in your experience, there needs to be more criteria?
Well, to be more, I think criteria, but I think there needs to be more of a definition of what homelessness is in our area. I think there needs to be more restraint on who's being admitted into facilities. And because they're there doesn't necessarily mean it's going to be used. So I have questioned whether or not a lot of money should be put into that. And quite candidly, the numbers are undercounted, okay? I know what point in time count is. I know what the numbers are being. I see over 10,000, okay? And I really research the numbers. Enormous population dealing with, and I think it's a spiritual crisis is what I'm saying. But I can't go around and tell people that, but that's exactly what I'm thinking. So,
but it is a crisis.
It's a crisis, but I don't know if we can fix it
What other folks think about that? Any?
I think she has her hand up, and I can go.
Just because you give someone a home, if they're experiencing chronic homelessness, or if they're experiencing chronic homelessness, just because you provide housing after months, maybe years of experiencing homelessness, doesn't mean that people have to be sudden to living in a house that has you have to provide those services for folks to be able to make that transition. So when we're talking about people experiencing homelessness, how are we also providing those services, be it social services, be it, job training, be it whatever it is that. So it needs to be a comprehensive solution. question and because like, I'm not a housing expert or for both persons and homelessness expert. However, that is something I've heard that, you know, just but like there's various types of folks who experience it, whether it's just because, you know what, I'm down on my luck, I lost my job, and everyone is like a paycheck away from being homeless, or it's just simply because, you know what, like my life got out of control, I have depression, I have, you know, anxiety, whatever it is, substance abuse disorders, that's there's different types. I think there has to be like a different, obviously a different approach for it, and we have to think about it more comprehensively other than just simply over. And also thinking about how we're leveraging this money with other funds from the state and the federal government, because kind of taking advantage of all the resources that are being made available nowadays because California is in a housing crisis, and the governor is paying very special attention, hundreds of millions, billions of dollars in this specific topic. So how are we using that kind of efficiently?
So comprehensive solutions and leveraging a more holistic and by just more state resources bringing it all together. Is there, so you've heard from a lot of folks.
I just wanted to agree with what she said. It's not an isolated instance of just having shelters. It has to be much more comprehensive package. If you want to stabilize families or those who are provide services in terms of where they're at, not where I think they should be at. Well, my opinion about what needs to happen. You said that you spoke to some homeless people. Account program, and within a matter of days, 77 units were taken. This individual spoke, he'd been a truck driver, he lost his job, he got to drinking, he was very proudly proclaiming that he'd been 2 weeks sober. And so you need to stabilize people, you need to be able to give them the right services. Drug and alcoholism, studies in jails to put mentally ill people.
I would like to also say transitional services, like she was saying, because of the different variations of reasons why people are homeless. I've spoken to many of them, and one of them in particular comes to mind was a gentleman, a black man, who was jailed because he was possessed of a weapon. So he was on Social Security because he had a permanent disability, some work injury, and he was receiving that as a source of income. Because of the neighborhood he lived in, he chose to protect himself. Carrying a gun. He was pulled over and arrested because of that, and he spent a few years in prison. But once he got out, he was now ineligible to continue receiving the Social Security. And because of the programs available, I guess either qualification process taking too long, or, like she said, requiring too much information he didn't have available to him. The city or whoever decided to finalize all of the assistance for him. So there definitely needs to be more assistance for those people that are dealing with that transition between being homeless and getting into a house.
The long term is the creation of removing any barriers that the city and folks that have housing.
And maybe we can come back and put both of them together and talk about affordable housing, which is the next priority statement. So that's the second needs statement, increased development and rehabilitation of affordable housing for low-income and special needs households, particularly in high-opportunity areas. A quick overview of a high-opportunity area.
Sure. So high opportunity areas are areas areas of the city are the opposite of homes. Areas where there's more access to jobs, maybe school situations are better. One of the accusations that have been made against our kind of programs nationwide is that we tend to subsidize keeping people in places where they have more opportunity and fewer options. And so the focus be creating opportunities in those areas where you have access to better schools, better public transportation, libraries, I mean sidewalks and so on. So that's a major debate right now. Just here. So, Portland, Oregon is a Portland, Oregonian, so far as to say, continuing this investment areas for subsidizing segregation. That's certainly one point of view. And so it's one of those things that's being worked through right now. There's different cities that are looking at different things, so that's one of the reasons.
Any questions or clarifying questions about the statement itself? Not necessarily, but just this statement
If I may say, one of the things that I've kind of offered as a solution to homelessness is building 3D printed homes, which is fortunate that the government hasn't utilized its technology yet. They can be built less than 24 hours, they cost less than $5,000. And of course, took some of the undeveloped land in the city, and you got those not in my backyard type of people. And find out where these communities could be built. But that would be a low, affordable way to provide affordable housing, as well as provide transitional housing for those people that need to get off the street immediately. Families with small children, our military veterans, teenagers that are suffering from addiction or got kicked out of the house for some reason. So I think that should be considered, because as much as I feel like the money would be best suited, to do other things, as a taxpayer, I feel like it's like a black hole. It seems like year after year after year, we presented these solutions that does nothing to remedy the situation. It's like everlasting. So when do we finally put a Band-Aid on it to heal it forever?
and so for you that solution is
100,
but generally housing.
Yes,
Affordable housing. That's the big thing.
we got, all right, so the governor just said he's going to spend, I don't even know, millions of dollars on temporary trailers. $11 million, another $11 million down the drain to temporarily house the homeless in these trailers. And again, $11 million that was built, used on building these 3D printed homes, and they'd immediately be off the streets. So it's a waste of time, it's a waste of money, and it's a waste of resources altogether. It's a waste of our time, because you're bringing in the community to hear us out, but yet none of the solutions we asked for are actually implemented. We don't know what's going to happen after today. But a year from now, if those 3D printed homes aren't built, we have a problem. It's that simple.
Temporary doesn't eliminate the accessibility. At the end of the day, we put these build a whole bunch of these trailers, and at the end of the day, there become slums. Tear those down and move those people be back. We really don't do anything for them. That's something like that. But to just even this development, high opportunity areas. Those who reject and don't want low income people in those areas. To do those kind of things. So the only way you can begin to even try to change that or transition, first of all, begins with a change in these low-income people's mindsets and transition them again into something to be ready to move into these more high opportunity areas, more accepted and basically fit in and more prepared for high opportunity areas. Otherwise, on the surface, just because they know these low income. That don't mean that they can't succeed and do well, but they need more successful and eventually
I got mine. NIMBY is in the backyard. Does the city, by virtue of accepting needs to do more in the area of putting forth policies to address that kind of issue as well. And I'm just going to ask about the analysis.
We're actually going to present that hopefully at a series of workshops in February, but they are working on it right now. It was actually part of the survey, but it is one of the reasons that we've listed fair housing as one of our priority statements, because we really feel that there is an inequality of access to other protected classes. So yes, it's underway. The maps actually access the site. They're available. It links directly to and I used to be able to rattle them off, and I can't, so I apologize. So, race, ethnicity, natural origin, sex, disability, in the state, but I don't know if it is national. I can't, as an owner or as a lender, or as someone who, say, you're wanting to rent an apartment from me, I can't make a decision based on any of those.
And discriminate against us.
I can only make based on income or and actually now the state of California just passed a law, so I can't say someone who's on Section 8 vouchers can't be counted as part of the income. Which is pretty cool. It used to not be, but it's pretty cool that it's being counted now. So as a lender, are we seeing disproportionate rates of lending to different groups, different classes? All analyzed as part of our analysis of impediments for housing. We're doing something that's a crossover. So it used to be we only did the analysis of impediments for housing, and then there was policy passed to use essentially a commitment to furthering fair housing, affirmatively furthering fair housing. We still make that commitment. It's no longer required as part of the document. We're actually going to be producing a document that would be consistent with that, even though it's not necessarily. But it's something we're working toward. We feel like when we spend our dollars, we need to be as a community. So that's part of that plan. And that'll be another series. Welcome back to sport.
Stay in touch with us. We will land these by
Yeah.
I do seem to see that opening up another door. Because now it's an issue of if the tenant has an issue with the landlord, they now have to pay for the attorney. They don't have the funds. See what I mean? So are there any programs then available to provide legal assistance of tenants?
So under our we do fund education
that in addition to the educational piece. But it is something that is an eligible activity. We have to cover it under our administration, but it is an eligible activity.
So the answer to your question is yes.
Sorry.
There are agencies in town that help, and I work for one of them, which is Central Health and Human Services, but the need is so great. It's just tremendous. We could do housing services all day long. It's not even but a drop in the bucket.
One thing I think just for all of these programs, but especially, access to affordable housing and assistance to, making those services and housing available to undocumented populations, because right now it is virtually, there is not a single organization in the Central Valley that provides legal assistance for free to undocumented populations, and getting access to affordable housing. I also don't think there are any housing options for undocumented. So oftentimes, time and time again, there's housing code violations. There's with the new rent control or anti-gouging laws. The law is great. Folks can only, put a piece of paper and say you're violating my, you ran this law and you should do this. So making sure that, across the board, all of these are available. But I think I do agree with, ensuring access to affordable housing, especially in high opportunity areas. Historically, just like many cities, we do have, with segregation where, if you pass where it's a lot nicer, so making sure that we are breaking down that stigma, especially. So if you finally have neighbors who are low income, who do look different, who are immigrants, over time we'll start, getting that acceptance that we need to have, rather than being like, oh, you came from this part of town.
What do we currently do?
With fair housing?
Yes.
So right now, as far as I know, almost impossible. But I know what it says, so I can tell you. I'll use it as a visual cue. So the fair housing education and referrals, that's through
the fair housing.
So programs to educate the public about fair housing resources that are available. And they also serve as the main agency that we
They're the ones doing the testing, but we don't actually per se. But in their reporting, they tell us how many cases.
For the education, no, not the full 11%. That's a portion of that category.
Yeah,
It's
so
$40,000 a year.
And this pie actually represents what these priority statements, these 6 statements, were in a previous annual.
The $40,000 was that the most amount that was ever put into that, or has it been more before? It's just less now.
It's actually increased since I've been here. It was either 20 or 30,000.
We've increased it each year a little, well, not enough. Louisa was on the HC, on our commission that advised staff and the city council on how we spend our dollars. And so,
Most programs are down from the pre-2012 levels. But since 2012, 2 of these federal programs took a 53% at the federal government level. So it's not exactly a good comparison to go back to before 2012.
So, like Jennifer was saying, the fair housing education now, what this preliminary recommendation is, no, Yeah,
So instead of including it
Right.
in administration or compliance, we're separating it out as a priority by itself, so that we can, and we'll talk about at the end kind of what we're doing with this information, but essentially we prepare a draft plan that goes to the public for input, and then ultimately the city council. And if they approve these priority statements, then what you're saying is we're going to spend money on these activities. This is important to us as a community, we're going to spend money. So I can guarantee that fair housing, education, and services will stay as its own priority, but we're asking you, do you think it should be its own priority within, what, we're looking at a very limited pool of resources, right? Should we continue to spend money on that, and should it be its own priority?
I'll tell you one thing that concerns me. I think you kind of mentioned like your comment on the Portland Oregonian, is that what it was called? This is what I have questions about is why are corridors of town always the same four areas? Since I've been right, you go right with the Cala, Southwest Fresno. Yeah, Southeast Fresno, and in particular right around the zip code right here. Why are those the same areas of like as long as the Pine and Momentum? Looking at the historical aspect of it, it's always been that way. So I think it needs to be asked. Or if not asked, it needs to be put forward so people know that it was discussed.
It's to implement this general plan we adopted a few years ago and not open it up for acquisition outside of the current city limits. And we need to invest in low-income neighborhoods as was planned in the general plan. Give the resources in those areas to make it.
I think the issue is the education aspect, because when I'm looking here, there's a few people that I know who are interested in this, and they didn't even know about this company. I only stumbled on this because I happen to go to Central Valley Community. I was looking at some stuff, and I saw that. The people that I know who wanted to be so that's how I know about it. So that the educating is a huge priority, but you have to educate in those certain spaces. So like you said, if it's Calico or Malibu, or if it's on the west side, or if it's the east side, whatever it is, like these places have been how they've been for so many decades. Those places have they have to be educated, and they have to also be probed to know that this can something we deal with as far as fatherhood. We've done education, and we've had elders of 60 years old came and after the education asked me this one it's still even it's still possible for me to have kids. And we're like, of course, and it's almost like you should know that, but you didn't. It's something that he never knew, he never thought was possible, and he really is asking these questions. And I think the same question for a lot of these, especially like the homes. People need to understand it, but it has to be made available to talk about here, and we give it to Central Valley Community Foundation, give it to the people who are in the county and the city. It has to go over to go to Edison, go to Amazon, and happen to where more of it will not just one sheet of paper. And I talked with barbershop owners, people who actually involved in the community, and they were trying to go to the meetings like the last year or the time before. And I'm saying, I guess the dates were they were tentative, they kept being moved. And so he was trying to go, he went to one, and he was there, and he said they had a site or something they were supposed to go to, and then got changed. So it's something that's stable, and actually solidified so that they can come in and actually understand what it is that is best. How they can have and be heard, not even just be heard, how we can they can be taught. Because a lot of and even my people, African Americans or even colored people, there's a lot of stuff that hasn't been spoken to or to us. If that makes sense. I know there's a different type of topic. But aren't readily available to certain neighborhoods as it is in others. Things that are passed down the hand to certain ethnic groups aren't handed down because they're handed down from generation to generation, if that makes sense, without going too graphic. So they need to be taught, hey, you can own this, and this is how you do it. You can get on downtown, sign that you can go on the internet, and you can also have these resources to help you with funding, to help you with how to present your videos, how to those things aren't in the mind. It's not even
So you're actually getting into, so D there, what we're really talking about are public services. And in that category, we have things like job skills training. So that's the priority that we've listed, provide assistance to low income and special households. Right now, we do that programming that we have at community centers, senior programming, education, job skills training, things like that. So we can fund educational activities and services for the community. So maybe this is a good opportunity to jump into that priority here.
Before we do that, I want to come back to your question because I think it's an extremely legitimate question about why is it that after decades things have not changed. And I think that question needs to be well, something shared that something has changes.
I think that's what you said, but almost alluding to the fact that that's the way that you keep, I'm going to use a word, that you keep some people down by moving to certain areas. And I started working on the historical aspect of to see the same places that have been in crisis. I'm 56 years old, and I've noticed that for a long time.
And I think it kind of goes back to his point of like the education. Like I think of that around civic engagement. Like how, this is part of like your like whatever. You have a right to be here and share your concerns. So how are we making sure that folks are being heard? That we're engaging in communities that have historically been disengaged because for decades, Southeast Fresno, West Fresno have not been heard, have not been part of the process. And folks, after certain times of being kicked down and ignored and pushed out of these conversations, people get tired. So how is it that we re-engage populations? How is it that we meet people where they're at? Because this is, like to your point, I agree with you, but what I did disagree with you is the point is where you say, like, we need to be educated. No, I think it's vice versa because we all have experts, we all have knowledge. Whether it's like, hey, can you teach me what an analysis of impediment is? Cool, I'm going to teach you what issues of my community because I'm an expert. I know what I need. I know what's going to make just like you putting a sidewalk here is not going to facilitate me walking to this park. Like, no, I actually go this way to the park or whatever. So it's like kind of like a two-way street of educating one another and creating those opportunities and meeting people where they're at. So like working with organizations like yours, like you work with fathers and to facilitate that and break it down so it's not like a very high level of like, we're going to talk about all these like acronyms, but it gets very complicated, it gets very difficult. So, and I think that kind of leads to like the E and the F of like planning and administering because this is a process that's going to continue. Like, this process repeats every single 5 years, and then every single year on top of that, we come down to the nitty gritty of like, okay, we have $11 million and $11,046,392. How are we going to break down this? Like, tell us. So, like, how is it that we, this process, and not to mention, like, that Southeast Fresno is going through its own specific plan process right now. Like, I heard most everything here, Southeast Fresno. Not very many.
Next question,
Yeah. But like, I think, I think like that's where we leverage like all these opportunities and figure out like how that we like what else is out there because a planning process like the Southeast community planning process like that leads to more like opportunities where you can tell the city of like, hey, this is what my community needs. We need more parks. We need more communities. We need more vocational programs. We need whatever it is. Like, those are other opportunities that again this funding can connect to that. So it's like tying all these loopholes that, again, super complicated, but how do we work with, government agencies to make it a two-way street so we can educate one another of the needs and the resources that are available?
How are these dollars leveraged to address the issue?
When you get to be mayor, I'm gonna just tell you something. Today I filled out an application. I think their disclosure forms that I filled out asking me my involvement in all of these other things, and if I can possibly benefit financially from any of these things. So they wanted to make sure that I was on the right things. Okay. It wasn't so much that I filled it out, but you want to know what concerned me, that all that stuff was on there. That means that people were in there before I did that. That's what should concern us a lot of times when I hear about things, and I know that there's other things going on, and sometimes I get hurt because I feel that I've been left out of the loop by my representation in the area that didn't tell me those things were happening. But a lot of times we don't get an invitation to the dance to participate, and I get on and until after the fact we're reading things. I'm reading things that happened in November, and I research a lot of things, and I see the same name showing up over and over and over again. So fix that. There it is. We should have that thing turned on.
So to circle back for providing assistance to low-income and special needs households, is there consensus that it's mainly the education side? Do you feel like this is a good need statement? Would you tweak it at all, or does it fit well?
I think it's a good statement, as I mentioned before. I think, ensuring.
What the goals really are.
How would you write that, Steve?
Well, I mean, just you hear a lot of different ideas that all fit kind of under that category. I mean, it became expansive just start talking about it. And maybe some of the other things kind of intertwined with that, but this isn't directed at all really to any specific area. For example,
en fuentes que son accesibles a ustedes. Que tal vez el correo electrónico sienten que
so wraparound, you would say provide wraparound service to low
I wonder if it can be based around households and special needs households, to ensure a certain quality of life, to ensure a healthy living, to ensure, whatever needs they identify are being met. Because then we, then it's not as abstract, and we hold it to where it's like, okay, that means legal services for everyone. That means, I've had a lot of issues where, homeowners who are low income, but unfortunately to own their home, but they can't rehab it. So it's energy inefficient, so their PG&E bill is through the roof. They don't have heat, they don't have air, so that's super harsh during those times. So I think those are programs that I've heard that would fall under, but I think it needs to be broad enough to where that can you can define those groups every single year, but do have a goal like housing, quality of life, or whatever. Whatever the end goal is.
So that's the first issue. Ensure a higher quality of life. So if we said provide wraparound services to low-income and special needs households to ensure a higher quality of life. Are we getting closer?
It's more definitive.
Does the service need to be wraparound? Just take advantage of that opportunity.
I actually don't know what wraparound services
Yeah, that's
You
what
can define that.
Oh,
please.
I was thinking the same
I was like, you know, let me do the definition. Wrap around it.
Mental health services, they might need, someone who can, transportation services, they might need job assistance, they might need childcare, programming, so each of these services wrap around them while they're continuing.
So would like home rehabilitation fall under that as well?
So, in terms of prioritizing dollars, that would typically fall under affordable housing. So rehabilitation of existing housing, so individual homeowners or rental units, and then
I assume that was just rental there, so it includes both homeowner and rent. Okay.
The wraparound services, is that primarily for folks at risk of becoming homeless or that that's targeted to everyone
I mean, the homeless programs to some extent already recognize the program, particularly the homeless program, they're integrated, but to take it outside of the homeless world, wraparound services might be operating a job training program, a training tests, childcare services.
Children that comes with someone who helps to case manage the family, because low-income families, especially when you take a look at, one of the greatest in the population increases is women and children. And not being able to find housing, or how many of you are familiar with the book Evicted? I did a case study in Milwaukee, and it's been proven for lack of $500, you have to prepare your car to keep your job, and there goes your rent money. For lack of a small amount of money, they wind up losing their home. And once you get an eviction on your record, good luck.
I mentioned that the eviction turned into like a $1,500 fine.
Absolutely.
On top of after, just because you couldn't pay.
Absolutely. So it's not just one problem that mother with the 2 young children faces. It's one problem after another, crisis after another. So the stability wrapped around is let's provide the services to stabilize this family and let's move them to self-sustainability.
I know it's a difficult task to say that, to bring everyone up to self-sufficiency. But I think ultimately that is literally the goal. Even with homelessness, what I was going to say first, I mean, the issues with homelessness is not them being homeless or the shelter that they need or infrastructure. It's person, and then it's monetary. I mean, that's how someone is homeless. Person, meaning whether it's mental health issues, whether it's dealing with somebody who's just lazy, whether it's dealing with somebody who doesn't want to take them out. And then the other side is monetary. You can't have a house, you can't have energy or cleaning or anything. So I mean, you have to deal with the person, and you have to deal with the monetary, or the opportunity to create that fund as well. And that's another whole nother issue, because we can have all these programs like we've been saying, they'll continue to be here until people or someone is today known that this is your responsibility. And this is, not only your responsibility, but also the pride of ownership. That's how you stay in that spiral. Like again, $500 if you don't have enough. It will continue to just bounce on. You're juggling. You're juggling your life.
The idea I proposed about 3D printed homes, part of that would be you have access to the home for free for a year. Within that year, you gotta get a job. part of it, because if you want to make things, the program shouldn't be there forever, you know? There's other people in line, or, you know, the new families, unfortunately, that may need that home. So you can't just give it to them and expect them to have it forever. It should just be that step up to the next level.
And then just really generational poverty too. And so the kids that grew up and saw their parents on welfare and so on, they become, they're looking for their chance to go around and sign up to get that check too. It all becomes a generational poverty. And so it ends up in certain areas, because the ones that can afford it not, they're up there. Consequently, you're trying to bring in programs that want to bring them and move them into those areas. But change mindset. Teach your kids' mind and says, I don't want to be on where I'm going to go to school, I'm going to listen to these programs, I'm going to, you know, you don't break the cycle. And, you know, in 10 decades from here now, these areas will look the same as they do now.
Exactly. But that's the only way that's going to, it's going to have to be something that's implemented. Like 2 generations. It's not going to be something that's
It's very young at this point, but the ones that are already there, they're set. Most of the time, their mindset that's all they're gonna do. They don't even have the effort in it. But the younger people can come up and transition and have a brighter outlook for the future. And that's worth an investment. Exactly. Yeah, that's worth it.
And I think part of that is just opportunity. It's not necessarily like the cyclical thing that people want to stay in. Is what opportunity do they even provide in the first place to get out of that? Because all those folks that I work with, it's simply like, I am not making enough money with that 2-3 job to be able to buy a home. To be able to, and we have to recognize that, you know, it's not just the issue with people, but it's also the issue with like how much are we paying people? Do they have benefits? Do they have insurance? Because again, people are simply a paycheck away because of the wages that are being paid. So what opportunity to, you know, whether it's part of it is creating those opportunities to have that social mobility, while at the same time, you know, hoping, creating that educated workforce, while also hoping that, you know, the city will attract these employers that are creating those good wage jobs that, you know, aren't just perpetuating the same issues that we have seen in the past, where, you know, we're going to put, you know, this industrial facility that's going to pollute all of this much, and we're going to have 6,000 trucks coming in every single day now because of it. So how do we change that? And it's both ways.
I'm sorry, we can interrupt you. The Section D, is that the monies that are used for the job training programs?
What was the question?
For Section D, is that the job training programs?
So are you saying the priority statement D is that?
Would job training fall into that category?
It
Yes.
would, yes.
Oh, okay.
And just to share, we are for public service.
So much.
But there are some things,
I was
like,
involved with some of that stuff.
but Thankfully Nisha, for example, she's involved in a micro enterprise development training program. There's a way that it doesn't count towards the cap. And so there are things that can be done. Some other things that can be done to move some of the stuff that's under the cap outside the cap. But really, that's another plan and another conversation. I don't want to.
Because I've heard stuff, 85% of single parent households. 50% of what I work with is two-parent households. So there's a lot of single
Nosotros hasta tenemos el precio de
poverty, income levels, what they're living at, 77% crisis situation, all of this stuff.
hay un cafecito relajado. ¿Sabe qué está pasando? Relajados, hablamos.
I almost think that it needs to happen in places like this, away from that, because what I do represents welfare, and that's the way that you do welfare. Okay? Where we give out a lot of stuff, okay, and not a lot of people, services, because I think out of it, they need to get out of it, somewhere else.
Well, kind of goes back to what you said, like.
Yeah.
That program existed, like that sounds. So it's like kind of like I was mentioning like stuff that the city is doing that people just aren't aware of, like saying like how do we make these programs available and or just available like they exist. How are we getting that word out? How are we meeting people where they're at?
What's happening, and I look at you gentlemen here, and I say, why am I not talking about programs like what you guys do? Or reflecting back on what you guys do, and for whatever reason, we're not all interconnected the way that we should be. I have worked with DSS for 26 years, and I can count on my hands the amount of times that we've had outside agencies come what we do, because we're not the catch-all on everything we do. As a matter of fact, I work with a very tiny bit of the population, the one that wants to cooperate, but the other part I need to look at is the 70% that don't, that aren't coming in, right? How am I not able? What are we not doing to bring these folks in? It's not fair to blame the workers. It's not fair to blame me because they're not participating. But I think we need to visit why these folks aren't coming in. And there's barriers galore. I've heard you guys say stuff that my friends and I have talked about. You guys want to mess with your life? Don't go to school. Okay? Don't graduate from high school. Right? I do that every day. The average testing grade that I test out in most of my programs is 3rd grade reading and 5th grade mathematics. Try making a life like that with a suspended driver's license and a police record. How far are you guys going to get? You're going to be in a repetitive, simple promotion of welfare.
One thing I do notice is I think one of the common things is people don't know what they don't know.
Yeah.
And so that kind of fits with E and F. So with E, providing fair housing and services to help residents and housing providers understand their rights and responsibilities. Is that another priority that you feel is important, and does that encompass everything that you see in the end?
I would actually add to that one, like providing fair housing, education services, and legal services. Because I mean, again, you can educate someone so much, and they can know their rights. But if at a certain point, if the land just like, no, you know what, I'm going to take you to court because I have the resources and you don't. Like you need to have that backup as well.
As well as financial assistance.
So the one thing I deny there and maybe Mark is one jumped to and I want to wrap up so that we can give everybody an opportunity to report out at the end. But in terms of public infrastructure facilities, things that we should are sidewalks and lighting. For their needs a few years ago, funded sidewalks and lighting in their neighborhood. Public facilities like parks, top neighborhoods, park space, community centers. Are those priorities or are they not? I mean, I think that's a really important discussion. That's a really
The lack of public infrastructure in these older neighborhoods makes it almost impossible to build new housing. To make it a desirable like infill development. Water utilities
Kind of all interconnected.
Porque lo primero que vas tú a ver a una casa, que te dicen, hazle el open house, y ahí te dicen, ¿verdad? Te dicen en la open house, ay, hazle, está bien bonito, qué ilusión, tengo la casa, está bien. Y te dicen, a ver, ya que te enseñan toda la casa y todo, ¿verdad? Ya te dicen, ok, su número de seguro social.
Para su hija que pueda comprar ya una casa. Y le digo, la información está en el distrito que para los primeros compradores que tengan seguro, les dan ayuda del 8%. Entonces, si puede, está trabajando los ingresos y tiene un seguro. Si no,
ella es maestra, trabaja nada más 2 horas. Pasa, no te van a hacer nada, porque ella quiere que yo me meta en esto, que yo me compre. Yo tengo que comprarla porque yo estoy en mi casa la pagué. Yo tengo que conseguir dinero y comprarla. Entonces, si yo tengo 2 casos, no me van a dar el beneficio que ella puede agarrar. Ya me dijeron a mí que va a tener 2, si no puede ser.
So would you foresee provide public infrastructure facilities for
hay que considerar un down payment de alguien con una experiencia que piden un 20%, que de una casa de 200,000 y estás hablando de
Who all do you mean by anchor institutions? Because you're in the UNS folks.
Organizations that are in real neighborhoods, it might be, you know, on the corner of
De 3 a 5. De 3 a 5 millones.
it could be something as fine as that. It could be, you know, like, a park and recreation. Nonprofit organizations. I mean, I know of a really amazing one that is deep in the hood. And,
Es así dividirlas en partes iguales.
and when you go there, like I said, the last thing I want to do
Pues ahí entra, ¿no?
La segunda, ustedes escogieron los programas después de la escuela.
Any other thoughts on infrastructure? So I could kind of create infrastructure that enables neighborhood.
Education center.
se gastarían en los indigentes. Ayuda a esto. Ellos van a recibir ayuda. No estoy segura.
Give them jobs.
Eso potencialmente ayuda. Ahora, aquí nuestro comunidad no tiene servicios comunitarios. No hay
going out in the world, providing for themselves.
hay muchos baches. Como dice el señor, hay casas viejas.
My wife and I were just talking about
Bueno, oigo que la infraestructura y mejoras. Oigo que ahí falta
Sí, porque
dinero.
como dice la señorita, y tiene mucha razón aquí la compañera, eso tiene mucha razón. Me está recordando que esto es ayuda federal.
we already talked about
Que no se la ayuda que si ya van a tener un requerimiento por parte del gobernador, entonces vamos a preocupar los
Right across the street, there's a college campus. And on the other side, there's a massive church.
so all they can do, all the kids over there, all they do is wait and say, I'm going to high school, okay, then after that I'm going to college, and make sure I keep that.
They have everything they need right in their own backyard. Literally, they ride their bike past all three of these institutions, and it's right there. They're all beautified. They've got acres, and so over here, and all the housing, all the development, all of the it's all there.
High opportunity.
Exactly, but over here, we don't. I just saw them talking about putting Fresno City after satellite or something. So I mean, the opportunity, obviously, we're not gonna have. They're not. It's not even put in front of them.
How about one that opened this parking lot tonight?
But I think in the past year, I've seen like the city like invest like just small improvement. I would say like minor improvements that really I think make a difference in parks, especially where folks. Because like nothing works, so everything's just like 15 years old. So like I think Big H White last year got like the splash pad and then like a new jungle gym or something like that. I can't remember it specifically. But I think continuing those types of investments based off of the priority list that the city has developed would be really helpful. Like I think there was a splash pad here that was actually because of the CDBG dollars. So continuing those and including like, you know, our community centers like Mosquito, like, you know, this person's been here for a very long time. I'm sure they need a couple rehab improvements. So I think continuing that and then also like the infrastructure. You know, we're filling the sidewalk or creating a safer crosswalk, putting in a light, you know, actual like turning light because, you know, otherwise, even if there is like signs around, continuing that type of infrastructure investment is greatly needed based on that. And I think just overall, like as the city's investing or using any public, it needs to look at how is it that we're investing equitably rather than equally. We have to recognize that, you know, Northwest Fresno and Northeast Fresno are not nearly as one as this area. Like, you know, clearly the southern part of the city, you know, as you mentioned, for decades it's been is because for a long time we've either been growing outward or maybe now we're doing it like everyone gets a piece of the pie, but like realistically it's because we all need our fair share, meaning that, you know, not everyone needs the same size shoes, some people need a better size. Low income communities, but with all of the dollars that we're saying.
I was in an antique shop, I'm sorry to divert, I was in an antique shop a couple months ago and I found a postcard of the Fresno County Courthouse. And I don't know if you guys know the history, I'm sure you probably do, right? Okay, essentially what I'm we have served the poor for
hay mucha necesidad,
the Fresno County poverty on this side of town and this area since the 1890s. This goes back exactly what I was telling you. There are certain areas in town that have been designated for poor people, and they congregate in those one places. And that's why what you said struck me. It's almost like it's this is where you guys are at, and this is where you guys are going to stay. You know what I'm saying? And see, I used to argue with that. Did that really exist? That's what I'm starting to discover. It does exist because it's happening.
It really does.
Yes.
I mean, literally, it's so residents, and that actually aids in the effort for more.
Well, you go up 6 miles from my house, and the average median income goes up like $30,000. But then you start looking at all the things that are associated with that. You have at least one college graduate in the household. You have 2 parents that graduated from high school. You see all of these little specific things. 93727, the zip code is right here, and I was looking to see where everybody was at, and I was starting to see crazy things that were related to that. Folks not graduating from high school. I see ethnicity differences. I see a gross disproportion of Hispanics living in this area. I think it has to be mentioned in this area, right? Who's making standardized areas and you see staff and because I can't get out.
So we are almost out of time.
I'm sorry.
I think that our
So I need somebody else to volunteer to summarize Maybe some activities that you think are funding that you'd like to see the city fund. So just really brief summary of what we're talking about, and we're going to have them do the same. And then we'll talk briefly about kind of the next steps, because I already write their names and addresses on them because I want you guys to come back to our next meeting. This is a really good dialogue, and I'd like to continue. So, thank you.
Thank you.
Anybody, any volunteers for speaker? I know
We have to write it down?
No, you just have to report out to the other group.
Okay.
Some of the.
I don't mind.
Are you good? Everybody good? Okay. So now, we did rewrite provide wraparound services to low income, especially households to ensure a higher quality of life.
And then our
So we should add detail to that.
the same, so just really a priority.
And then some of them we have a lot. Are there any that we want to surface? We want to bubble up?
Okay, I hate to bring the conversation that we've already had 13 meetings, so I'm just telling y'all that this was the best meeting ever. So, we have two groups, and we're gonna give them each 3 minutes because I want to make sure everybody knows what the next steps are. We're gonna have 3 minutes to summarize. We're gonna start with this group back here. What were your big priority discussion areas and what types of activities you'd like to fund? And then this group will do the same. So who's going to be our designated speaker? Awesome.
We're just kicking that thing over. It's not going to last long. Thank you so much. See, the children are the future. They know the way. Our group pretty much summarized all of the issues here on the board as mainly being more services that's needed for the transition for people that are homeless to getting into home, whether it be mental health services, educational services, financial services, or I guess wraparound services that they're called, and that's more so just providing the means from start to finish to bridge that gap for them. Also, there is a need that we feel like to educate the younger generation on the aspects that have created the elements of homelessness. That way we can provide them with the tools necessary to avoid that themselves in the future. And of course, more programs for adults, job training programs, and what do we got? I think that's about it, right? But yes, as well as infrastructure, we would like to see possibly 3D printed homes, if possible, and educational centers, again, for those younger children and adults that are in need of those services. So I think that about wraps it up, right? Okay.
Good job.
Thank you.
Thank you.
My pleasure.
Thank you.
Okay, so this group up here, and I'm going to need you as well. We're going to do a little translation here. We're going to start in Spanish. About every sentence or so, you'll stop and translate. Okay?
Buenas tardes, mi nombre es Adela Moreno.
Good afternoon, my name is Adela Moreno.
Yo he seguido las participaciones de aquí de la comunidad.
I've been participating continuously in the meetings here in the community.
Y pienso que 11 millones no alcanza para todas las necesidades que ocupamos.
And I feel that 11 million is not enough for the needs that we have.
Si se dan cuenta, nuestras primeras necesidades es de que estamos mal con las viviendas.
If you can tell, around our neighborhood, one of the first needs or priorities is housing infrastructure.
Las casas viejas, queremos remodelación.
We want to be able to remodel older homes.
Darnos la oportunidad como inmigrantes, que nos den la oportunidad de comprar casas con 18.
Give immigrants the opportunity to be able to become homeowners even if they have an ITIN.
Porque los costos son muy altos, a diferencia del seguro.
Because it is a lot more expensive, a difficult pathway to become a homeowner when you don't have a social versus being an immigrant.
Y los trabajos que realizamos con el salario mínimo no nos alcanza para pagar esos costos.
And the work that we can participate in, the wage is so minimum, so low that we don't have the feasibility to be able to actually afford those costs of becoming a homeowner.
La otra también es de nuestra comunidad, está en muy mal estado. Un ejemplo aquí es nuestra biblioteca, que no tiene suficiente espacio para nuestros niños. Los libros que están ahí son muy viejos.
Another example of the needs in our community, for example, our library. Our library is very small and doesn't have enough of the resources, books that we need for our children, and it is an older infrastructure.
Queremos servicios para la comunidad, y cómo los vamos a poder lograr haciendo estos cambios ahora.
We want changes for our community, and how are we going to be able to get this through, making these changes now?
Y sabemos que nuestras calles no están pavimentadas, no tenemos luces, agua limpia,
We know that our streets are not paved, that we don't have access to water, that we have infrastructure needs.
Quieren pues fábricas que contaminan nuestra ciudad, poniendo más trabajo, pero ¿por qué no ponen? Yo siempre he dicho que ¿por qué no ponen unas tiendas grandes donde la comunidad tenga acceso a esas tiendas y son una oportunidad de trabajo?
We want to bring industry with the idea that this will bring more jobs to our community, but why not instead bring storefronts and access to just grocery shopping and other type of shopping
Como
areas.
Las escuelas están sobrepobladas, nuestras escuelas, nuestros niños no están aprendiendo académicamente bien.
Our schools are overpopulated and our children are not getting the quality education that they need.
Más colegios, más hospitales, más necesidades que tenemos nosotros como hispanos. No hay centros comunitarios donde podamos tener algún servicio.
We need more schools, more hospitals. We need more services, and for us, the Latino community, we need more services that we can have in our local area.
Yo soy una voluntaria de la comunidad y yo estoy aquí para que mi voz sea escuchada. A mí nadie me paga por participar en estas reuniones. Yo gasto mi tiempo es valioso como así el de ustedes, y todo se les respeta.
I am a local volunteer. I don't get paid to be here. I am here because this is important. And just like several of us are here because this is important. Some of you get paid, and that's what brings you here, but this is important.
Las personas también que son los homeless no tienen servicio que pienso que es de primera ayuda, salud mental. No tienen algún servicio así que tenga nuestra comunidad.
Are homeless, I really feel that mental health is something that is very important for them to have because they don't have good care when it comes to mental health.
Realmente, si ustedes tienen los ojos abiertos, tienen que saber las necesidades que realmente nosotros tenemos, y a diferencia, notamos mucho la diferencia, y no es que nosotros querramos, sino que la vemos en la realidad.
And if we all just open up our eyes, we don't have to be asked about the needs. We can see the needs and the difference between this community and other areas.
Muchas gracias por su atención.
Thank you for your attention.
Le faltó tantito también, también lo que necesitamos mucho
como comunidad inmigrante es asistencia de abogacía, asistencia de abogados que sí en realidad asistan a la comunidad migrante, porque actualmente si no eres ciudadano o si no eres residente, no te pueden ayudar aunque tú pagues impuestos. Así es que necesitamos ayuda de abogados.
One area that we forgot to mention here is we did talk about the need for advocacy and legal services for the immigrant community, because even though we pay taxes, we don't get this type of support and we don't get the type of legal assistance that we also need to be able to better have an assessment of our rights and what we can do.
Quería decir otra cosa, ¿sí se escucha? Que todas las necesidades, por eso digo que no las cubrimos con 11 millones, porque realmente hay más necesidades y cómo podemos, nos dan a escoger nada más 3, entonces cuando hay más de 3.
And once again, I have to reiterate, 11 million is not enough to cover all of the needs that we are facing. And right now we're being pushed to pick and choose, but in reality, there are so many more needs that we are not addressing at the table.
Y una cosa importante que estaba olvidando, ahí en los 11 millones que dicen que ayudan después de escuela, los programas después de escuela, les quería decir que nuestra realidad no nos están, esos programas son como cuidados de niños, porque no están, nuestros niños que se quedan ahí no están aprendiendo académicamente bien preparados.
And I wanted to mention these after-school programs that money is being invested into. Our children are not learning anything. It's like having childcare after school. They're not being enriched and they're not really getting any type of academic support in these programs.
Queremos algo de calidad para nuestros estudiantes que por eso se quedan después de escuela, porque van mal.
We want something that will actually enrich our children's lives. That is why they stay after school, because they need that extra support.
Tengo muchas cosas, pero ahorita se me olvidaron.
And I have a lot more to say, but right now I'm short time.
Excellent. Like I said, this was a hard one to cut off because we have so much to talk about. And I think you summarized it very well by saying that $11 million is not enough, and that's why we need your help. So this week we are conducting 3 workshops. This is the first of 3. We have 2 more this week. And then we are going to be putting our draft together. So all of these priorities that you have helped us talk about, to revisit, to redraft the wording to make it more meaningful to the community. We will be making a presentation to our advisory commission on our draft consolidated plan, so these priorities, our annual action plan, which are our 1-year goals, and how we would finance, or what types of activities we would pay for in the first year, and then the analysis of impediments to fair housing. We will have meetings, so that will be meetings in February, and then we will publish that document for public comment in March. Following that, we will have additional public input at our commission as well as at the city council, and then we will be submitting our document to our federal agency, Housing and Urban Development, for their approval. We're doing things a little bit differently this year. In the past, what we have done after we do our needs hearing like these, then we publish a request for agencies to submit proposals for activities that they're going to use the dollars to do, that they would like to do. We're not going to do that this year. We're going to actually do it after the city council identifies and approves these priorities and the specific activities they'd like for us to do. Because I really want it to come down to those meaningful activities. You have each identified meaningful activities you'd like to be considered for funding. And once we have that funding list, then we'll be asking nonprofits, agencies to submit proposals of how they would actually implement those activities that we've talked about. And then one-year plan will start July 1st. So we'll be submitting our 1-year and 5-year plans in May, and then the actual work will begin in July. And I think we talked about at the back table, this is a never-ending cycle. So a year from now, we talk about which specific priorities we want to fund in the following year. And we continue that annually through this 5-year plan. But your input has been really important tonight, and I hope that you signed in. It's really important that we have your names and your addresses or your emails so that we can contact you and let you know of our next series of meetings, because we hope that you will join us again. So thank you for coming out tonight, and have a good, safe evening.
All right. And if I may give you my card, I would definitely like to keep in touch with you. Do you have one as well?
Yeah,
excellent. All right.
I'm trying to be better at them.
Thank you so much.
No, thank you.
All right.
Your comments. Yeah, I'd love to learn about the services y'all provide.
Let me tell you what I do. I do the life skills course. I do the welfare tour orientation. I do what's called the sanction care, where folks have been taken off the cash and they have to come back on. So I see a lot of different folks.
All right, you guys. Hope you enjoyed all of this. I know it was long and tedious, and if you're still awake and we're paying attention, the people of Fresno, we want to change. We want the money that's being implemented or given to our city to be implemented on changes, real changes that we can see, since we can see the problems all around us. And we want to help the children in our community, and of course, all of the families that are struggling. So please stay tuned. Until next time, long live liberty, y'all.